does sleep mean to us? Okay. Sleep is an essential part in everyone's existence. We progress and we evolve. We slowly forget the value of sleep in our daily life. Together with technology and opportunities, we turn night into day. Here we are working in jobs that are not possible a decade ago. We have information in our hands at any time of the day. We are connected to the people of the world. As a result, we stay up longer than what our body allows us to be. Remember, we spend a third of our life in sleep. We need this time to repair our body, and spending less time with it would lead to many consequences. The sleep medicine in the Philippines actually started in 2002. It was officially formed. But the first sleep specialist actually arrived in the country in 1992. Fortunately, she had to leave early, but she was here earlier. And the sleep society, in sleep medicine, it's actually composed of different specialties. You have your pulmonologists, you have your neurologists, you have your ENTs, you have your psychiatrists, and pediatricians. So we all work together in treating patients who have sleep disorders. But not known to many, okay? Even with doctors, they're actually not very aware that there's such a thing as sleep medicine. In fact, some doctors even are surprised there's such a specialty. It is also the youngest subspecialty specialty in medicine. Okay, and this is the same with other ASEAN countries or neighboring countries. It's slowly developing. It's developing, but you know it's taking some time. In this 2017, the Philippines will be hosting the 4th ASEAN Sleep Medicine Congress. It aims to foster research and collaboration amongst our neighboring countries whom we share similar cultures and habits that are particular in this part of the world. You'll be surprised, different cultures have different habits that, you know, that they don't actually practice elsewhere. Okay? So sleep is universal, but cultures actually does have some impact on them. So I will introduce you to our panelists. So we have different sleep doctors. I'll introduce them one by one. First of all, first it's Dr. Gina Villas Reyes. She's actually the current president of the Philippine Society of Sleep Medicine. She practices here in Lung Center of the Philippines. Then we have Dr. Agnes Remulla. She's the vice president of the society. And she has a sleep clinic in Asian Hospital. We're fortunate that we have a speaker who would participate in the press conference, Dr. Tripat Singh, which is an international sleep medicine specialist. He's from Singapore, and he's a clinical manager for sleep in the Philips Healthcare of Singapore. And we have Dr. Deborah Bernardo. She's a neurologist from St. Luke's, Quezon City. And we have another panelist, Dr. Dwayne Salud, from Davao. So I formally open the panel for any questions that you have with regards to sleep. I understand a lot of this is mixed media. There's some of you that are bloggers, which is something that we're quite new. I just learned from yesterday that you can use the hashtag thingy. So any questions from the media? Yes? Do we have microphones?
Good afternoon to all the panelists. Any one of you could probably enlighten us on how many hours would be the ideal sleeping time for a person, let's say an adult person, 18 to let's say 40 or 50 years old. Any of the panel?
So just last year, the American Academy of Sleep Medicine and the Sleep Research Society of the USA came together to create a consensus about this, and they recommend 7 hours and up as the healthy sleep duration for adults. And this was based on studies that showed that If you sleep 6 hours or less per night, there are bad effects, and sleeping longer is also associated with higher risk of death.
So although it's 7 to 9 hours for adults, we also have to consider the variation in the duration of sleep that you need depending on the age. So school children probably would need longer hours of sleep rather than an adult. Like a neonate probably would need 12 hours, a baby would need 12 hours. But the trend is usually as you get older, then the number of hours that you need would be lesser also. But as an adult, meaning age from 18 years old to even up to 70 years old, you would need at least 7 to 9 hours of sleep. And it also will differ not only for the age, but also the culture and also the genetic makeup.
Thank you. Hello, good afternoon to everyone. I'm Edison from Malaya Business Insight. So I have two questions. First is, why did you choose to why did the Philippine Society of Sleep Medicine choose to collaborate with uratex? And the second one is, how did your team come up with the slogan this year, which is the good sleep is a reachable dream?
I'm gonna answer
Maybe
that.
Keith could answer that.
It's not actually uratex. Uratex is, we're actually working with a lot of other industries with regards to this. We're going into industries that are near our patients. You have your bed, you have wearable technology. We recently just did a press con with them as well when it comes to the role of technology and how it can actually help with sleep. Because, you know, the industries is very important. They're the ones who actually are, we're only about 40 sleep doctors. 40 sleep doctors in the country. Our country, they computed it, it's about 2 million per doctor. We cannot serve everyone, or we couldn't actually reach to every patient, especially if we're busy in our clinics ourselves. So we're actually partnering with other industries so we can actually reach out for more patients. And beds are usually one of the nearest that you can actually get into. It's one thing that you look at for a good sleep. Sometimes after they buy a bed, they would still find it, you know, their sleep is not that good. That's the only time that they would probably come see a doctor. There. And with the slogan, it's actually decided by the World Sleep Society. The World Sleep Society is an organization of different sleep societies around the world. So we actually just recently joined the World Sleep Society about 2 years ago, and and that's why we started becoming more active with the participation in World Sleep Day. In fact, each and every hospital who has a sleep lab has their own event. We have a few weeks ago we had the lay forum. We have right now we have exhibits in some hospitals just to increase awareness of sleep.
So we decided to highlight the World Sleep Day, which is celebrated everywhere, because sleep is a condition that is much different from wake. So you're supposed to spend at least 7 hours of sleep every day, and that's a huge chunk of your life. And if ever we needed time to work or do anything else, you would sacrifice sleep. But there is great importance in considering how you sleep and providing yourself and informing other people of how important sleep is for your general health and even safety. So there are many dimensions to sleep. That's why the society took the initiative to celebrate and conduct our conventions at the same time to highlight this event. Now, why is sleep important? As I said, it's nearly a third of your life. You're going to be asleep. And that's when you repair yourself. A lot of things happen when you're asleep. And we all take that for granted, us included. So if you needed to work, then you'd sacrifice it. It's a big deal now. And if you watch the news, of course, it talk about issues on extended work hours, particularly in show business. And of course, anything that show business puts out the foreground gets much attention. And for that, I think personally, I'm thankful for the discussion. But now that there is more that sleep sleep is important, that we have problems with sleep, and there are things that we can do to help ourselves, and that you have specialists that you can approach and we can help you make things better. Thank you.
Yeah, just to ask a question regarding the sleep. What's the best time to have a sleep? We have like 7 hours, more than 7 hours. So what's the best time?
As human beings, we should sleep at night. Okay? That is what we are supposed to do. But with the changing society, changing needs of the professions, we are changing ourselves, and which is impacting our health. And so that is what I feel. Still, the best time to sleep is at night.
What time would that be from night? Would that be from 8 o'clock to 4 o'clock or?
Okay, I would like to answer that question. When you are hungry, do you look at time? We just eat.
Yeah,
The best time to sleep is when your body says
I'm tired.
you need to go to sleep. Don't try to fix a clock. That may lead to one of the problems. I may not fall asleep. Will I fall asleep? Listen to your body. It will tell you. You need to sleep. That is the time when you need to retire to the bed.
To adapt, it's not like the quantity of sleep that we're talking about. We need to also to look into the quality of sleep. We need to have at least accomplished this different stages of sleep, especially the slow wave sleep, which is the rest of the deep sleep. So we need to reach that one so that we will be considered as the quality.
So you had an excellent question. The question was, when are you supposed to sleep? What time of day? And it's true that you cannot peg a time to it, although some people are so regular that they will do like clockwork. 9 o'clock, they fall asleep. However, our bodies follow biologic mechanisms that are quite primitive. So we actually follow the sun. And that's why when the sun sets, it's the first trigger for your body to slow down and initiate mechanisms that will help you fall asleep. So sunset varies. Different parts of the world, the Philippines is fairly consistent, but more or less our bodies will follow the cycle of day and night. So that's why we, as humans, we naturally prefer to sleep when the sun goes down.
Hello po. Ay, okay. Sorry.
Go ahead.
Can I add to
Yes,
that?
okay.
Final word on your question? Because probably you're thinking why what about people who have to sleep during the day?
Yeah, and
Especially you're working in the
Call
media,
center agent.
I'm sure you're awake all night.
Yeah.
Okay, preparing for the deadline
Deadlines.
tomorrow. Okay. But unfortunately, really the body, our brains are actually designed to sleep at night. Dr. Rimula said it's something to do with the circadian rhythm. And that's why there's a phenomenon which we call the shift work disorder, wherein people who are forced to sleep during the day and stay awake at night would have either insomnia at night, actually sleepiness, extreme sleepiness when you're trying to work, and at the same time we're going to have insomnia or difficulty going to sleep during the day when you're supposed to be resting. So that's a reality. Okay? So there would be people who would develop this shift work disorder, and you just have to be aware that it occurs and choose, I guess, your job accordingly. Because there will be some who would actually fit well into that schedule. But ideally, really, we have to, the best thing would be to sleep in the normal time, which would be at night.
Just to add to that, all of their answers are quite different, but basically what it says is, every person, every individual has a particular, cycle. So some are short sleepers, some are long sleepers, some are actually late sleepers, some are early sleepers. So it really depends. So it's very individualized. So you can't actually generalize a person, but people. But in general, people actually just sleep during the day and they wake up at night. So it's very abnormal for you to actually sleep during the day.
Reverse, right?
To reverse it, that's going to be difficult. That's when you encounter problems, which is what we refer to as shift work disorder. It's such a disease actually, or a condition. Hopefully that answers your question. It's a simple question, but it's difficult to actually answer.
Alright. I'm Carla po from The Standard. For those who has sleeping disorder, what should they need to do to avoid it?
What particular sleep disorder?
Like insomnia.
Dr. Bernardo
Just gave a
lectured.
very excellent lecture earlier.
To avoid. So, first, make sure that you follow healthy habits. Like they said, the sun tells you that it's time to sleep, so you go to sleep. You try to go to sleep. And then you avoid substances that will prevent you from sleeping, like caffeine and other energy drinks, those things. Smoking. So these are the things that you need to avoid.
Yes, hi, I'm Marian from Asian Dragon. I'd just like to ask, because I often experience this, hello, yeah. I don't know if it's the right term, but a lot of people call it sleep paralysis. So it's like your mind is awake, but your body is not. You can hear everything that's happening. So what do we do to prevent it? Is it preventable? And what causes it?
First of all, sleep paralysis is not very common and it's a benign phenomenon. And one of the simple reasons for sleep paralysis can be sleep deprivation. Okay, so we have to look into it. I have suffered from sleep paralysis myself. And the reason for that was sitting in the sleep lab and getting myself deprived. And the only remedy was I have to sleep back, get my sleep, symptom just appeared.
Okay.
Basically, if you have sleep paralysis, as you have said, you have the underlying problems, like for example, sleep deprivation. Sometimes the circadian disease has that one. If you lack sleep, probably there's a lot of people who experience that one. So we need to look at the underlying cause of that, then treat it.
And as Dr. Kepat said, it's benign, so don't worry about it.
Actually, it's an interesting question. I think most of us have experienced it at one point in our life, especially for those who work really hard. What happens is that, REM sleep, right? Rapid eye movement sleep. It's what we call a dream sleep. Okay? And during dream sleep, we're having dreams, but at the same time, what happens is that the body has atonia, meaning we cannot move. And that's nature's way of preventing us from acting out our dreams. But what happens in sleep paralysis is, actually we're already waking up, our minds are awake, but the REM atonia is still there. Meaning atonia, no tone, we cannot move. So we're kind of paralyzed. And sometimes what happens is the dream, which is part of REM sleep, intrudes into the wake sleep. So don't you have the experience that you're looking around you, there's a monster in the room who's chasing after you, and yet you cannot move, and it seems that you cannot breathe. So that would explain the phenomenon of sleep paralysis. REM sleep intruding to the wake sleep. And as of that, they mentioned earlier, it's usually a sign of sleep deprivation. Although there would be cases where it could be associated with a rare condition, at least in our country, of narcolepsy.
Is it alarming? Have you experienced it like 3 nights straight?
I experienced it at one time, 4 times, one after the other, after going on duty for 48 hours.
Is that alarming? Or what should you do to wake yourself up from that? Because it's very scary.
It's only scary because probably our grandmothers told us that you have to move, otherwise you're gonna die. But actually, the Antonia wears off by itself. And all you have to do is just relax. It's going to wear off.
It's usually your toes that can move first. So don't worry, move your toes, then everything else will follow. It's usually scary because it's a scary feeling. Parang you can't breathe, or somebody's lying down on you, and those scary things are sensations that you have. But you can be okay.
So 3 days in a row means your body is complaining that you need sleep. So that's all it is. You need to get some sleep.
Parang nasa short circuit na walang you have to rest. Good.
Good afternoon to our panelists. I'm Dr. Steph de la Cruz, writing for MIMS and also for my blog, stephdelacruz.com. My question is about our trainees, our clerks and interns. So you've mentioned before, Dr. Remulla, that we are among the most sleep deprived. So considering that their sleep deprivation is going to affect their performance, like if they go into surgery, if they are the surgeon, it might affect their performance. Is the Philippine Society of Sleep Medicine thinking of changing the way we train our clerks and interns?
All right, as a part of a teaching institution, I will tell you that in the recent years, the rules for duties, length of duties of students have changed considerably, such that there are a lot of rules for shortening time at work. So what we used to do, we'll go on in the hospital 36, 48 hours is not allowed anymore. You can only go on 12-hour duties, and you have mandatory rest periods. And the reason being that when they looked at performance in hospitals, that the risk for medical errors due to sleep deprivation was always there after being sleep deprived for 12 hours. And there are a lot of issues with this rule. You can argue for it and you can argue against it. But currently, the move to change sleep hours was actually initiated in the United States by their own sleep society. We believe in the same principles that we should follow it. Medical schools on their own are beginning to follow these rules. But as a sleep society, yes, we will continue to work towards spreading this initiative not only for medical school training, but also for other fields that require longer hours and unreasonable times for their employees and students.
This actually applies to even nurses, everyone who goes on duty. In fact, the people in the call center actually have a better schedule than us. That's why we're trying to reach out, not only to the population, but also to our colleagues. In fact, I'm sure everyone who got back from training abroad, who got back from sleep training, specialize mo sleep. So magaling ka na matulog. That's basic. They make fun of our specialty in a way. But there's a lot of things that are very, very basic that institutions actually overlook. Schedules of students, nurses, resident doctors, and it's very difficult actually to change the minds of these institutions. They're institutions and they would say, okay naman kami, during our time we didn't actually have any problem. Sabihin pa sa inyo na you're just making excuses if you make your schedules a little bit shorter. But there are other two issues that concerns changing the schedule, like continuity of care and care for the patient. Because you can't just change your doctor every 8 hours. It's different from nurses. You can't do that. So once you are in charge of the patient, you are in charge of the patient until the patient is discharged. So that's another issue that it's open for debate. I don't know with Dr. Kapat, how's your experience with the schedule in your training? It's similar?
Very bad.
It's similar. I mean, it's not only in this country, it's everywhere.
I have a couple of questions, but my first question is there a proper way of lying down on a pillow? That's my first question, because I really have a hard time sleeping because I don't know the proper position of lying down or using the pillow.
Again, Again, a simple question but difficult to answer.
Yeah, is there a proper way of lying down or using a pillow?
Let's, who do we start with? Okay.
Peace.
Again, this is a perfect example of a psychophysiological insomnia. You are thinking too much about how to fall or how to have a good sleep. You are concentrating so much on the pillow itself that you are unable to fall asleep. Again, try to understand the basic philosophy behind sleep. Sleep is just like your food. When you are hungry, do you think that I should eat with right hand or left hand? Do you do that?
I use my right hand because I'm a right-handed person.
Yeah, exactly.
Okay.
And similarly, sleep will come to you. You don't have to worry so much about a particular posture.
Okay.
Let your body loose and let it take whatever posture it is convenient in. There is no right and wrong. The most important thing is you should sleep.
Okay.
There is no right or wrong way of falling asleep.
Okay.
I think I have a different take on that. You might have insomnia, psychophysiologic insomnia, as Dr. Tipat mentioned. But the first thing we have to do is to make sure that you have the right pillow. Okay? Because if you're thinking too much about how to sleep with your pillow, maybe it's not really that comfortable. It might be too hard, it might be too high. Because otherwise, I think for the majority of us, we don't think about the pillows, right? So, first of all, just make sure that you have the, because it matters. Including the bed, including the pillows, it would matter. Okay, so as long as you have the right pillow, it's soft, and it's conducive to sleep, then that shouldn't be a problem in what position. Now, regarding the position, aside from the pillow, if you find yourself that you cannot lie down flat on your back, and you always have to lie on your left side or right side or prone position, also check, do you snore? Do you have apnea, meaning your roommate would say that sometimes you pause breathing?
Yes. Sleep apnea.
Right? And then when you wake up in the morning, in spite of a long sleep, you feel tired. It might not be the pillow which is the issue, but it could be a sleep apnea. Because sleep apnea usually happens when you lie down flat on your back. So probably that's the reason why you have to go to other positions.
Okay. So the next question is talking about sleep apnea. Is snoring or sleep apnea part of sleep?
Yes. It's snoring and sleep apnea part of sleep. Sleep
Yes.
medicine, you're saying.
Yes, it is. So all conditions that occur when you fall asleep is considered part of sleep medicine. Now, sleep apnea, having that name, defines the condition itself. It occurs only when you're asleep, and apnea is cessation of breathing. So, it means that when you fall asleep, there are times when breathing stops intermittently, and then you have problems that come along with that. So, as like a disorder, yes, it is under sleep medicine, and yes, you may benefit from positioning yourself properly if you're the kind of patient who has sleep apnea, because lying on your side is often better, positioning your head to optimize position then and the size of your airway, there's a way to do that, will also help people who snore.
Okay. Thank you, Doc.
Hello, good afternoon. I'm Saving of ScientificLiving.com. According to the articles that I have read, lack of sleep contributes to weight gain. But why is that? There are some people who lack sleep but then lose weight.
The question is weight gain and weight loss. Some people actually don't gain weight when they're sleep deprived, but instead lose weight, right? So, who wants to answer that question? Dr. Gina?
Okay, when you lack sleep, okay, sometimes the body interprets that as lack of food because your energy goes down. Okay, if we're going to go deeper into the hormones, we have what we call leptin. This leptin hormone would be a satiety hormone. So it tells you that you've had enough food. Okay? So it prevents you from overeating. At the same time, you have what we call a ghrelin, okay, which makes you eat. So what happens is that when you're sleep deprived, the leptin goes down, okay, the satiety goes down, but the ghrelin goes up, so you eat more. So, right? So the tendency would be to eat a lot. And not only just food, any kind of food, you tend to eat more of carbohydrates. And that's the reason why they notice that for people who work at the call centers, they tend to gain weight.
Yeah.
Or for students who are reviewing for an exam, when they're sleep deprived, they tend to eat more. So they gain weight. And the other question is, how come, that's for the general rule, but other people, if they don't sleep well, then you said, how come they lose weight? But you could also look at the other factors. Maybe this person is not sleeping so much because there's a lot of physical activity. So that could also be a factor for losing weight.
And insomnia can also be just a symptom of another problem, like what Dr. Bernardo lectured earlier. Some people are anxious, depressed. There are other conditions that can actually. That what Dr. Gina was saying is the natural, reaction of your body is you try to eat more.
Hi, I'm Katsi Faustina. I'm an architect and a blogger for lipsticksexpenses.com. So, coming from designing built environments, does the Sleep Society have a recommendation for ideal sleeping space to promote better sleep quality?
Well, part of the advice for people who have difficulty sleeping is to control your environment. Make sure it's optimal for sleeping, and what is that? So when you have the opportunity to sleep, the room should be kept dark. So in people who work at night and sleep during the day, there should be a means by which they can block out light. Temperature should be regulated to a comfortable level so that it's not too hot, it's not too cold. Noise should also be considered such that, if you had a neighbor with a noisy dog, then that's a problem. The kind of sleeping material that you prefer. Some would like a softer bed, a harder bed. Those are other things that you factor into the environment that you will be conducive to sleep. There is no standard, there's just general advice.
Hello, it's me again. So, dear doctors, we are here because the Philippine Society of Sleep Medicine has partnered with uratex. So we were invited here to ask a question. So my question now is related to the bed. Some say that we should have softer beds that allow our bodies to, that would follow the contours of our bodies. Others would say that it should be firm, but there are different schools of thought. So I haven't had the time to review these suppositions. So maybe you can enlighten us as to what the perfect bed would be for us.
Okay, me? Again, it's a easy question, but difficult to answer. Every individual actually has a specific specification for you to sleep. Firm beds, depending on how you sleep actually. If you sleep on your side, sometimes it's best that the bed contours your body. Makes your spine straight, at least you wouldn't have any muscle pain. Pillows are also very important. Others actually prefer a firmer bed. So it really depends. In fact, when you choose a bed, you actually have different, like beds kasi, like pillows. That's why I'm particular with the beds. And if you choose a bed, there are actually different types of bed. You can actually change the firmness, you can actually change the material of your bed, even the pillow. But basically, when you choose a bed, it's like what they were advising, it should be, you're sleeping like when you're standing up. You should have a straight body. It doesn't curve your spine. That should actually make strain some of your muscles. You eventually might wake up with a sore neck. Okay, and of course, if you're a snorer, you might actually prefer lying on your side with a specific pillow. Of course, usually when you lie not too high that your bed it bends on the other side. When you're lying on your back, it should start from the shoulder, so your neck doesn't bend forward. So those are actually basic things that ortho people actually tell their patients. This is, although it's still part of sleep, but it's usually the ortho people who actually deals with it. And if you're a snorer, like, you might prefer sleeping on your side or on your belly. There are actually pillows that are designed to straighten your neck. So that just makes your airway a little bit open. And there are pillows that are designed to force you to sleep on the side. So every individual would have a different type of specification. So it's really hard to answer a question. It has really to be individualized.
May I add? Okay, it also depends if you have a bed partner. So if you have a bed partner and your bed partner moves a lot, then it's better to have a bed that will allow that person to move, but you won't feel the vibration or the movement. And there's specialized beds for that.
I'll tell you a story. That we have a really soft bed in our sleep lab, and our beds are usually, our patients actually like the bed. Parang when they wake up, this is the best bed that I've actually lied onto. But you'll be surprised, our patients who are severely obese, they hate that bed. They hate that bed because they actually sink in, and they can't even turn because it's just too soft for them. So sometimes we remove that's why when we see a patient looks a little bit heavy, we have a specific bed for that kind of patient. So iba-iba talaga siya. So it's really hard to determine which bed suits a patient properly.
Hi.
Hi.
My parents told me that.
I just wanted to know. My parents told me when I was a child, I do sleepwalking while I do drugs. What's the cause of sleepwalking and what's the solution?
Child? Bata?
Bata.
Okay.
Or even adults.
Okay.
Sleepwalking is one of the diseases that we are termed parasomnias. These are activities that you normally do when you should be sleeping, but you don't while asleep. And it's just like sleep paralysis. It's most of the time benign, but it runs in families. So they do not know the exact cause, but it runs in families, and it eventually disappears as the child ages.
Just to add on it, we have to look at the underlying cause for sleepwalking also. Sometimes it is just obstructive sleep apnea, which precipitates episodes of sleepwalking. We treat obstructive sleep apnea, sleepwalking disappears. So, like ma'am said, it is benign phenomena. Most of the time it goes away by adulthood. But if we have a person like 20 to 25 years old who's still having sleepwalking, we will try to explore any underlying sleep disorder in that patient.
Actually, when we talk about sleepwalking, there's a pattern of that. May pattern yan sila of what time they sleepwalk, and then what I usually do, I assign a sleep diary for the patients, and then there's a pattern. And then if the pattern is 11 o'clock, the first cycle of sleep, the pattern is 11 o'clock, you wake them up 30 minutes before so that they can disrupt the pattern. So by that, you can treat the patients.
Hello, ayan po, ako ulit. There are many relaxing music that many people think about that it can help them to have a good sleep. Does it really help?
Anything that will make you relax will help you go to sleep because it reduces the arousal levels of the brain. So whether it's music, sometimes natural sounds, or like we talked about earlier, some forms of muscle exercises, anything that calms you down will help you fall asleep.
Hello po, good afternoon. I'm Bel Solana from Eagle Broadcasting Corporation. If there is sleepwalking, I'd like to ask, why is it that there are people who talk while sleeping? And if you answer what are they saying, parang, yeah, totoo yun. They answer, di ba? Nakaka-relate.
Ang pangalan ng kasama mo kagabi.
Opo.
Dr. Tipan. The question is, there are people who sleep talk. And the question is, how come people who sleep talk, if you ask them a question, they seem to be answering a logical answer based on their, seem to be conversing with you.
We don't know the exact reason why people sleep talk. And again, we consider it as a benign phenomenon which disappears on its own. And only thing I will say is, if it's an adult patient who is still sleep talking, we may have to look for any underlying sleep disorder. That's all I can say at this point.
So sleep talking is in the same family as sleepwalking and all those strange activities that you can do when you're asleep. Now, often you will be in deep sleep, which is very common in children. They have longer deep sleep periods, and then something just wakes you up in the middle of it, but you don't wake up completely. So there's a mixing of characteristics of sleep and wake in one state in the patient, and that's why a patient is asleep but walking, patient is asleep talking. In a child, it is benign, but you have to find out, as was mentioned earlier, what that trigger is, what brings the patient out of partially out of sleep to make these behaviors come out. And it's not as simple when you consider adults, because the sleep of adults is very different from children, and often there are more underlying problems when you have it in an adult. Now, as to content, what the patient does when they start moving, when they start talking, what they say, it actually is not part of sleep medicine anymore. And you could argue that, these are things that the patient thinks about, what the patient heard before, but the content itself is not really, well investigated, and we cannot give an explanation for what the patient actually says. Thank you.
No more questions? Naubos na yung tanong ninyo? You can ask anything.
Yung intermittent sleeping,
Intermittent sleeping? Guys, asking about intermittent sleeping. What do you mean in particular?
Mababang tulog. Konting pagpus lang.
Mababang tulog. Shallow sleep.
Shallow sleep.
So how would you explain why some people actually experience shallow sleep?
What age are you referring to?
Like you, ma'am. In my age, 35. Sometimes sa madaling araw nagigising ako, tapos gising na naman.
Because it would be different if it's an elderly person with a lot of illnesses. For instance, with diabetes, they tend to go to the bathroom a lot, especially for elderly patients when they take diuretics for their heart problem. They urinate a lot. But for a younger individual, you have to look at your pattern of coffee intake, probably cigarette, because these are stimulants, especially alcohol. Okay? If you have, alcohol is actually tricky. When you take it, immediately after a few minutes, you feel sleepy. Okay? And you think it's a good hypnotic, or it helps you go to sleep. But as it gets broken down, okay, the metabolites, the breakdown products actually would cause disruption of your sleep. Okay? There would be episodes that are going to wake up periodically. So alcohol is not actually a good idea to take, let's say, 3 hours before going to sleep.
How about yung drinking water before to sleep?
If you drink too much water before you sleep, there could be a problem because your bladder will get full, and after a few hours, then you need to wake up in order to go to the bathroom. So the idea is, do not take too much water, even food. You shouldn't take too much food before going to sleep. Because again, especially with fatty foods, there's a tendency that instead of your body going to sleep, it's going to concentrate in digesting the food. And you might also be prone to having reflux, gastric reflux, so that would also disrupt your sleep.
That would induce us normal sleep. So, melatonin, if you...
Okay lang po yun, doctor. Okay lang po na uminom.
Yeah, it's okay lang po yun.
Dr. Bernardo, do you have any input on that?
Melatonin is normally produced by the brain in tiny amounts. and it's supposed to be enough for us to go to sleep. But we use it occasionally for sleep onset insomnia, and it should be in very low doses. The best use for melatonin is actually for jet lag. The best evidence has come out for its use more in jet lag than for insomnia.
Okay, so we have one last question before we end our Q&A.
Hi, good afternoon. I'm Babe Slim. I'm from an advertising agency. My question is actually for my husband. I'm particularly concerned because he's been working at a BPO company for the last 13 years. I wonder if there are definitive medical repercussions to practicing reverse sleeping habit, meaning he's awake at night, of course, and he sleeps during the day. Are there any consequences, health-wise, to that?
Like we said earlier, each cell in our body follows a clock. Even the cells that make your... There's a specific rhythm for hormones, for other bodily functions. So when you sleep and wake up opposite of the time that these cells are supposed to function, there will be long-term consequences.
If I may add on that, there have been long-term studies on what happens with chronic sleep deprivation. Because it's not only the timing that you could consider. I'm sure that because he has to work opposite the normal wake-sleep cycle, then there's probably a tendency for him not to sleep that well. So we're also dealing with poor quantity of sleep. And there are studies that if you don't sleep well or sleep deprived chronically, then it's linked to several illnesses like hypertension, diabetes, also problem with your cholesterol. And in some patients, it could also be a risk factor for having mood disorders like depression. And not to scare you, of course, you have to look at the other things. But it's associated with that, even with cancer. Also for women, that might also impair their childbearing. So really, the consequences really widespread across all the different systems of the body. That's why for patients who need to work on those conditions, the patient should be vigilant in looking for these illnesses.
And to add to that, well, some people have no choice. Work is like that, that is the work that is offered to you and you have to take it. The key there now, although it is not an ideal setup, is consistency. You stick to your schedule. Even if you have a weekend off and you want to spend the daytime with your family, ideally you will stick to the time that is required for your work. Otherwise, it's like jumping from different time zones and 5 days that you're working and the weekend that you're off. And your body cannot tolerate that shift very well. So that one, aside from having unnatural sleep-wake cycle, will add stress to the body. And that's why it breaks down earlier and you get all these illnesses. So if you are forced in that situation, then the best that you can do is be consistent. Maintain a good lifestyle, be consistent with your sleep and wake. It entails a lot of sacrifice socially, especially for people who have families. But that gives you the best option to stay healthy and stick to that work schedule.
Anything to add? No more? So you see, there's a lot of things that you actually sleep